The Rundown with Carrie Saldo podcast is funded by Armbrook Village, offering research-based arts, music, fitness, and lifelong learning programs at their assisted living and Alzheimer's care community in Westfield. armbrookvillage.com.
This is The Rundown, your weekly news and review from Western Mass. I'm Carrie Saldo. It's Friday, November 15th. This week's news posse: Larry Parnas, the executive editor of the Springfield Republican newspaper; Karen Brown, a reporter right here from NEPM; and Matt Safransky, editor-in-chief of Western Mass Politics and Insight, joining us on the phone. Good morning, everyone.
Morning.
Good morning.
Good morning.
Later in the show, our rundowners discuss the impact access to some drugs, legal and illegal, is having on the lives of Western Massachusetts residents, Bay State Health's decision to cut over 130 leadership jobs, and digital equity, where it stands in Springfield and across the 413. But first, the votes are in. The Republican trifecta has been completed. Republicans are holding the House of Representatives. This comes, of course, after last week winning control of the presidency and holding on to the Senate, taking the Senate. GOP leadership of the House has a very direct connection to Western Mass because it means that two leadership positions that might have been held by members of the Western Mass congressional delegation will be held by Republicans instead. Namely, Congressman Richard Neal will not be chair of the House Ways and Means Committee, and House Rules Committee will not be held by Congressman Jim McGovern. Matt Safransky, politics is something that you eat, sleep, and breathe. What are your thoughts on that for this region?
Well, I mean, I think, there's the big question about whether or not, this is because the House didn't change that much. I mean, we're looking at maybe at most one seat gain for the Republicans, I'd say. I mean, maybe might that change a little bit, but it suggests that it's just as close as it was before. So if there are any thoughts or ideas out there about maybe, either McGovern or Neal, throwing in the towel and, retiring, it might just be still tempting to wait until 2026 and see if they can regain the majority. And some people may remember there was a bunch of speculation, just a little under 2 years ago when top Neal aide departed, and that ended up being, completely unnecessary because he intended to stick it out. And I think that might be the most impactful thing, is whether or not, the speculation machine starts bubbling up again here in Western Massachusetts.
Well, we will keep watching it with your help if that speculation machine starts to bubble over. All right, let's move on to our first topic of the day. Faced with operating losses, Bay State Health cuts 134 leadership jobs. This is something that the Republican and NEPM took a look at, among other news agencies. Jim Kinney reported for the Republican this week, quoting Jim's work here. Bay State Health has cut 134 leadership jobs, less than 1% of its workforce, as the healthcare giant works to cut expenses and boost revenues by a combined $225 million over the next 2 years. Bay State announced those layoffs on Wednesday. Larry, in some ways, not a surprise here. Bay State had made some public discussions in recent months in the Republican with Jim, but still tough for those losing their jobs. What are you watching here?
Well, Peter Banko, the new CEO, did, as you just said, Carrie, describe the situation he faced as the new leader of this really, really important business. 13,500 employees. It's really the dominant healthcare institution. It really, I think you could say that as goes Bay State Health, so goes the region's economy. Mm-hmm. He says that he knew from the board through his conversations in interviewing what kind of situation he was walking into. They have a massively complex problem, but I think he's found some straightforward answers to it, which is to reduce expenses and look for new revenue.
And he's been very careful about saying what some of those reductions will mean. I'll get into that in a minute. But I want to bring in Nancy Eve Cohen spoke with an RN at Bay State Franklin Medical Center. Her name is Marissa Potter. And Potter told Nancy that she hopes that the direct unit managers are among those who will stay employed.
I think it's really important that they not eliminate direct unit managers. It's not unusual in my unit for my direct manager to put on scrubs and help us out in an emergency and take care of patients hands-on.
Because I think one of the things that Baystate, Peter Banko and Baystate has been very clear about in this announcement is saying that they don't believe that this will affect quality of care or level of care. And I know that a shortage of primary care physicians in Western Massachusetts is something we've been talking about for quite some time. And Karen, it's something you took a look at in your reporting. The Baystate also said that it's going to continue to hire physicians and some other folks. When you looked at this in February, Karen, this shortage of primary care docs, what did you learn?
Well, I mean, this is a problem that has been going on for years and years, and it's just very hard to get people to go into primary care and to have direct care because there's less money involved, there's more bureaucracy. So I think Baystate is very wise to tell the public that we're going to continue with this bedside care, but I also think it's worth noting that we don't really know what that means, leadership positions, because that can also affect primary care quality. And I think that's what we were listening to with Nancy's story, that if this is managers of bedside care, that's going to be a problem. You know, it's not just a matter of unnecessary positions.
Yeah, and Baystate was very transparent in the recent weeks, saying to the Republican that over 3 years it had lost $300 million in operational funding between 2020 and 2023, and it lost $150 million in investments in 2022 when the stock market took a hit. Larry, go ahead.
Yeah, I think one of Peter Banko's main challenges is, he can change some expenses immediately. 134 leadership positions. That's a reference to management positions. The first three were all directors and chiefs of departments, so it's pretty high up. It's not middle management. It's not the nurse supervisor who comes in occasionally. This is my assumption here, to fill out it with some bedside care. Banko's real problem is that, like a lot of hospitals in New England and in parts of the country with older populations, they rely heavily on Medicare and Medicaid reimbursements, which are low. He's not going to be able to change that. And in fact, with this new administration, it could get worse. Yeah. And then the other thing is they're losing patients to care centers like Hartford and Boston for higher level medical care.
And less mass health, too.
Yeah. And he's speaking of trying to deal with that, but that's going to be a matter of perception and public trust and public just confidence that you can get the best available care in New England in Springfield.
Speaking of that public confidence, that public trust piece, Matt Safransky, I was thinking about how Banko came out and said a few weeks ago, look, here's the financial position we're in. This is going to mean job losses. And now following up, coming forward with that, did that transparency, that level of transparency surprise you at all?
I mean, yes and no. I mean, I don't want to say that Baystate has been an opaque institution, but I think it is kind of austere just because it is so large. I mean, it literally looms in the north end of Springfield when you're talking about the facility there. But I think it does speak a bit to the understanding that you need to have this public conversation because Baystate is effectively a hospital of last resort in a lot of in this region. It relies very heavily on the state's investment, the state's spending into the healthcare programs, and without that, it simply wouldn't be financially feasible. And it also has other hospitals. It has of course, Noble in Westfield and Franklin Medical Center in Greenfield. So, I mean, it needs to be a little bit more transparent so that people, will trust it, and also, for that matter, trust their partners in government to help them out. And I would be remiss if I didn't note, the Steward situation where, private equity firm basically, drained its hospitals and created this chaos more so out east, it's very, very, very different than what Baystate's going through. I don't want to give that connection at all, but I'm just saying that there's a big thought out there on Beacon Hill about how are they going to be able to keep these institutions going against the headwaves that Larry mentioned from Washington, in addition to just the unfortunate fact that the socioeconomic conditions in Western Mass are very different than they are in Eastern Mass. And that is ultimately the driver of many of the challenges that Baystate will face, and frankly, the other health institutions in Western Mass will face at some point or are already facing.
Karen Brown.
Well, a lot of this also has to do with the way healthcare is funded and financed in our country, and it would be nice. I don't think this will happen, but if if there is a renewed conversation on fee-for-service, and this is why so many hospitals and healthcare institutions don't do well, is because they rely on a system that just doesn't work. And this is why a lot of people say we need single payer. I don't see that really being what we end up talking about.
Two other quick points I just want to make before we moved on. Last month, Peter Banco also said that, I want to just give this as a frame of reference. People hear layoffs and these big dollar numbers and they get nervous, I think rightfully so. He said there are no plans to close facilities or reduce services. And then I'm quoting here, I am 100% convinced we will be very healthy 24 months from now. So we'll be checking up on that, all of you, I'm sure, and we'll follow that here on the rundown. We're going to move on. Headline, Springfield studies digital equity to ensure all people have computer access. This is something Jeanette DeForge looked at for the Springfield Republican. And she says, with the help of a $102,000 state grant, a Springfield City Council working group on digital equity is teaming up with the Pioneer Valley Planning Commission to develop a plan to ensure residents have better access to technology. There have been a series of listening sessions, Larry, as part of this. What did Jeanette hear at these sessions?
That there's still a problem. The broadband divide has changed from there being access to high speed to there being affordable access. Now, I guess that hasn't really changed. That's always been underlying all of this. The state, after this really many year push and hugely expensive investment, hundreds of millions of dollars to build out a middle mile, which didn't really prove that effective, and then the last mile work. And it came through, Matt, I'd love to hear your thoughts on this, through a governor who really didn't embrace public sector solutions to what he saw as private sector operations. So through the course of investing a lot of money in this, Comcast and Xfinity and all these private providers have gotten and continue to get tens of millions of dollars to build out parts of their existing networks that didn't reach everybody. And the whole more recent effort to find digital equity for broadband was to get it to everybody. And that's true in all the towns that Whip City Fiber, who's been very aggressive about this, has handled. But the state shifted to trying to provide both devices and training, and now with these grants helping bigger cities like Springfield come up with their own solutions on how do we get everybody connected to this public utility that is essential.
But to your point, Larry, Governor Deval Patrick came out in 2007 saying we're going to have broadband across Western Massachusetts by 2011.
Came to Goshen to do that.
Yeah. You were there reporting on it.
Yeah.
And obviously,
he had a vacation home there, to be fair.
Richmond, right?
Yeah.
But why does it take us so long to wrap our heads around these issues? Matt, do you have anything to think about that?
Well, I think that a big part of this is, and I think this is kind of what Larry was alluding to a little bit, is that it's not just building out the infrastructure. On a strictly, technological infrastructural level, a community like Springfield or even Holyoke, it's probably mostly wired, maybe not directly into homes, but that's something that the utility itself will do. But then there's the question of cost, and internet has become an essential in the way that phone service and electricity were essentials. People forget. You look at the bottom of your phone bill or your electric bill, there's little itty-bitty charges on there from the federal government and the state that essentially go to subsidize what is, in effect, unprofitable services, whether that's in the form of rural areas where there isn't the density of service, but also in subsidies for people that could not afford it. Nobody today would stand for someone living in anywhere in the United States, certainly not a city, and not have electricity. The phone service is a little bit different because that's evolved with cell phones now, and you don't necessarily have to have a direct line in there, but internet isn't necessarily the same thing. Not everybody can afford to have an unlimited amount of data on their plan so that they could use their phone as a hotspot for internet service. So this is a big issue that I think it has to evolve beyond just the technological question. And there are some municipal solutions. The especially because a lot of internet services provided by cable companies, and the cable companies are experiencing a lot of people cutting the cord. The municipalities do have the negotiation leverage if they use it appropriately to try to get the most for the residents who are still disconnected.
Yeah, it's just very quickly before we head to break, Larry, to that point on who is connected. I know you've looked at this extensively for the Berkshire Eagle, and last time I think I saw your report out in 2022, kind of who was left remaining without reliable high-speed internet. Do we have the current number?
You could count them on one hand, fingers of one hand.
Well, much better than it was.
Yeah,
It was
yeah.
over 50 before.
Yeah. But there have been starts and stops, and it's sort of tragic. If you live in the areas that the companies never wanted to cover and never would cover, you're still struggling, like Savoy and Hawley. They tried a wireless solution, put up a tower on a mountain. That didn't work out. But the cost of getting fiber up these little roads is incredibly high.
Something we're going to keep talking about here on The Rundown. We're going to take a quick break. What's next, you ask? Well, our Rundowners are going to look at the impact that access to some drugs, both legal and illegal, is having on the lives of residents here in Western Massachusetts. Stay with us. We'll be right back. Welcome back to The Rundown. I'm Carrie Saldo. Joining me this week to delve into the news that you can use from the 413, Matt Safransky, Karen Brown, and Larry Harness. 2 different reporting series dropped last month, and we were busy with that election thing.
Oh, I remember that.
Yeah. So I'm circling back.
Oh, we still are.
Great point. Circling back to those now, this is reporting by Mass Live. The headline, how one machine supercharged illicit drug manufacturing in Massachusetts. It was a 3-part series reported by Mass Live's Hadley Barndollar, and it was also carried in the Springfield Republican. The use of pill presses to quickly create dangerous counterfeit pills that kill thousands of Americans annually has skyrocketed in recent years. Mass Live conducted a months-long investigation into what they are, how they've caught on, and what's being done about them. Larry, let's start with what they are and what they're being used to create.
If listeners haven't seen that coverage, I strongly recommend it. Hadley did a terrific job on this. So pill presses are these little Rube Goldberg machines that allow people in homes across Massachusetts and the country to do something that used to have been done internationally before drugs came into the country. Now, to improve their efficiency and profitability, people who are selling pills, counterfeit pills, can obtain these pill presses, mostly from China, and anybody can do that.
They're legal, according to Hadley's reporting. They were typically used by people in the pharmaceutical profession, or maybe somebody who wanted to make their own dietary supplements, something like that.
Yes.
These pills are not that.
Well, the machines are legal, but it's illegal to have a counterfeit dye or mold, and that's really the critical part of this. People take this cocktail of God knows what, usually including fentanyl, and they are selling it to people in the form and the appearance of an oxycodone or a pill that people have tragically have become over-reliant on. And Hadley's reporting involved going with DEA agents on some seizures, and they're saying now that in 80% of the cases where they do seizures of drugs, they're finding pill presses, and frighteningly, they're in houses in residential areas, in bedrooms next to where children are sleeping, putting
these are not
all kinds of people at hazard.
warehouses, huge warehouses in faraway destinations. These are being found in residential neighborhoods. And the thing that really stood out to me is, Larry, your point about the dye, the stamp that they're putting on these pills. It often looks like something you would get from a pharmacy, and people
that we look at and feel like, oh, good, we know this is legitimate.
It seems reassuring,
and it's not.
sure.
Yeah.
And then it's spiked with something lethal, which was the case for a South Hadley family. They interviewed a young woman, Carly Goldenberg, whose mother, PJ Peach, died after taking one of these pills. So the challenge and the the potential negative effects of these is incredibly real. Matt, Karen, what stood out to you about this reporting?
I mean, I thought it was a really interesting way to look at the problem. There's so many poisonous drugs out there, and there are so many creative ways that they are getting into people and killing them, sadly. And it would be so great if some of this ingenuity would be used to actually get people off addiction.
And we'll talk about that in a minute with you, Karen.
Yes.
Matt, go ahead.
I was going to say, I also think it's interesting how, our perception of drugs as a problem in society has evolved. I mean, there's always been a concern about, illegal prescription illegal use of prescription drugs. But, maybe it's partly because of the decriminalization of marijuana, but it's so much more focused on drugs that have to even have the appearance of legitimacy as opposed to, cocaine or heroin. It's something that is, trying to masquerade as something real and appropriate, and in fact, it's just become a symbol of a broader scourge.
Larry, go ahead briefly before we move on.
A quick thought: these pills are kind of a main avenue of illicit drug sales now, because there are a lot of people who have chronic pain, and they've been kind of cut out of legal and lawful prescriptions, and they have nowhere to turn. This was the case of Ms. Goldenberg.
Yeah, absolutely. Well, Karen, one of the things that you've been looking at is harm reduction around people, to Larry's point, who maybe have used an opioid and now have come to feel like they really need it. You did a series recently on methadone, which is stigmatized, but the headline says works well for many addiction patients, but it's very hard to get. What made you have you take a look at this now, Karen?
Well, methadone people think of as something from like the 60s and 70s, and it's, there are newer anti-addiction medications like Suboxone that are actually have become much easier to get. Methadone is still sort of stuck in this war on drugs attitude. You have to go to a methadone clinic. You have to go through a lot of different federal rules, which have been loosened to some degree. But I met a lot of doctors that say they have not been loosened to the right degree, and methadone actually works better than some of these newer drugs. And this is crazy. Why is it so hard to get this treatment?
And one person who you spoke with, Kellyanne Kaiser, who has been using methadone, she had an addiction story that she told you about, and she was explaining to you that really this is incredibly helpful, has been incredibly helpful to her recovery process. Just tell us a bit more about her.
Well, she works in a recovery center, but she has 3 kids. She's about 30, and she said she tried all these other treatments. Methadone is what allowed her to stay clean, but also the fact that methadone is now easier for her. There's a van in her town of Ware that is now just a few minutes from where she lives. She can take home bottles, so she doesn't have to go to a clinic every day. Like, these are tiny little details about how you get the treatment, but that is what allowed her to stay sober. And I think people just don't realize what it takes to go through addiction treatment.
And here's what she specifically said about the use of methadone.
I think just methadone is just what got me sober. Without that, I would still be using.
I mean, that's a powerful statement right there. One of the things that really caught my attention in your reporting was this nuance of how private equity has gotten involved and sort of stuck its finger into the methadone pie. What's happening there?
It's a very lucrative business. Methadone, the way that the government pays for methadone treatment through Medicaid, et cetera, you can make a lot of money opening a methadone clinic. So there is a real financial incentive not to make it easier for people to get it through their primary care doctor, through other means. That was shocking to me. Like, when is addiction supposed to be a moneymaker? In
Western Mass, in this regard, is sort of uniquely positioned because what Dr. Ruth Potee told you, who specializes in opioid treatment, is this.
It's one of the reasons why Western Mass is a shining star when it comes to methadone delivery, is because there's a lot of not-for-profit entities here, and we're able to understand the rules and put change into effect quite quickly.
And so how is that rolling out here?
Well, notably, Ruth Potee, the doctor we just heard, she runs several methadone clinics for BHN. She would love to see them put out of business. So, clearly this is how a nonprofit attitude works.
BHN is Behavioral Health Network, right?
Yes. And she's the one that started this van, and it sounds like she would love to see it be less lucrative and more accessible.
Now, on the federal level, you reported that Senator Ed Markey is pushing for legislation that would make access to methadone easier. Not the first time that this legislation has come up. Where does it stand right now?
Well, I mean, it's not going to go anywhere with the election the way it is and the national politics the way it is. You know, I'm sure he will try and put it out there again. But the idea is break the monopoly, allow methadone to be prescribed by board-certified addiction doctors, make it easier to get. There's a lot of opposition from the clinics themselves. We'll see whether he is able to reintroduce this legislation.
Matt, I think I heard you have a reaction to the private equity piece of this. What are you thinking?
Well, I think it represents a complication that is going to make it very hard for legislation like that of Senator Markey's to get through. I mean, I without getting too deep into the psychoanalyzing the electorate, I think that there's a very big skepticism of expertise, to say the least, and that's going to be something that the private equity lobbyists that own these clinics are going to use to push back on this, even if it did have a chance. I mean, there has been some traction on both parties about significant reform where it comes to opioids and addiction, but I think that's one lever that if these groups are determined to stay in business as they are, that they're going to use. And then I think the report also mentioned this negative perception that methadone just has anyway, and the idea that having any of these entities in your own community is just something people don't want. And even if you were able to actually reduce their presence because you could go through regular doctors, I still think you're going to have a lot of cynical manipulation of people's perceptions to try to not change the status quo.
And it's not like doctors are dying to become addiction doctors and to treat addiction.
Right,
this is
right.
something that people in that field say. The truth is, addiction widely has a stigma, and it's hard to get the treatment to anybody.
Well, really fascinating reporting from NEPM on what is happening with methadone, and Mass Live and The Republican on what is happening with pill presses. Their respective websites have links. You can find them on our page as well. All right, I'm going to move us on to our prediction, scoop, and praise portion of the show, where we ask our panel to make a prediction about the week's news, maybe spill the tea on a story they're working on, or heap some praise on a newsworthy nugget. Matt Safransky, I'll start with you there on the phone.
Well, it's kind of a non-scoop, but it is a prediction as well. Senator Elizabeth Warren, who won re-election last week, is going to be the top Democrat on the Banking Committee in the next Congress, although in the minority. And my prediction is that if you haven't heard her talk enough about the financial services and the banking industry and whatnot, we're going to hear a whole lot more of it in the next Congress.
I think that is a very solid prediction. Karen Brown, how about for you?
I think we're going into sort of a dark and difficult time in the news, and I think people are going to be looking for other lighter, more levity, more quirkiness, more humor, and that's going to be a challenge for us who are in the news business. So I am challenging folks to send me quirky ideas and humorous stories, and we're going to try and mix it up a little bit. So because I personally have a pile of unread newspapers on my own front porch, and end up watching It's Always Sunny in Philadelphia instead.
Fantastic. A little Larry Parnas.
Well, here's a little preview of something we're going to offer on Sunday. It's not been easy for a long time to be a Republican in Massachusetts or to win an election as a Republican. Many, many communities increased their margins for President Trump in this vote. So we're talking to Republican town committees. Do they see this as a moment where they can energize their ranks, or is this ultimately a vote for an individual rather than for a party?
Check the Springfield Republican for that on Sunday. Absolutely. Well, speaking of quirk, my praise this week goes to folks out there like me who have yet to take down every last one of those Halloween decorations.
But you put them up.
I think it is my way of stopping holiday creep, which is driving me nuts because it is everywhere. All right, you've been listening to The Rundown here on 88.5 NEPM. I'm Carrie Saldo. My thanks to Karen Brown, Larry Parnas, and Matt Safransky. We'll see you next week.
Thank you.
Thanks.
Bye-bye.